sharing my screen now. Well, it seems to take a while. So I've been asked to just cover some of the common gastrointestinal problems that we see in the horse. So this is going to be very much a bit of a whistle-stop tour, because I could probably talk for several hours on any one of these things. But so I'm going to talk first about colic, then gastric ulcers. We're going to touch on some of the things that affect the hind gut, and then we're going to talk a little bit about worming and responsible worming and resistance. So yeah, but before we get going, we really need to have a little quick lesson in anatomy. So I know I can't hear or see any of you, but if you could all just have a look at these pictures and shout out which species on the screen you think has got the gastrointestinal tract, so the digestive tract, most like a horse. Shout it out, write it down, and we'll come back to that in a few slides' time. So this is a schematic diagram of a human digestive tract, and as mammals, we're all loosely based on the sort of same rough anatomy. So as humans, we've got stomachs that produce enzymes that break down food. A lot of it will get absorbed then in the small intestine and then into the large intestine. So we get most of our calories from carbohydrates, which can be both starch and sugars, proteins and fats, and if you like most fats, a bit of alcohol as well. We can't get many calories out of plants at all. So if we were to just eat grass, like a lot of our herbivores, we would soon wither away. So if we think about a herbivore, so here is a sheep, this could equally apply to a cow. They have evolved to get the calories out of the hard cell walls, the cellulose in grass and other vegetation. And they've evolved to do that in a slightly different way to a horse. So they have 4 stomachs at the beginning of their digestive tract. So they've got very large, or several large stomachs, which break down or have bacteria and microbes in there, which then break down the hard cellulose walls into other products that then can be absorbed through this small intestine, which you can see wiggling away there on the left. And then they don't have a very large colon. So these guys are foregut fermenters. If we can compare that to a horse, we've got a very, very small stomach, and we've got a very enlarged large colon, so large intestine. So these guys, so horses will ferment plant material in their hind gut and then absorb the byproducts of that in the sort of hind part of their intestine. So horses can digest and absorb small amounts of protein and fat and carbohydrate, just like we do, but the majority of their calories will come from the fiber component of the diet. So just to compare, here we go, we've got on the left, we've got a foregut fermenter like cows and sheep, and on the right we can see in the blue how big the hindgut is of a horse. And both of these, or all herbivores, rely on the microbes, the trillions of microbes in their gut to break down the fiber. So it's a bit like brewing things. It's actually the microbes that break it down, and then into smaller products, often volatile fatty acids and things like that, which can be absorbed. But I often say to people, and I like to think that actually we're not feeding our horse, or we're not just feeding, cows or sheep, we're actually feeding the trillions of microbes that are in there, and anything that upsets them can upset the gastrointestinal health, particularly of our herbivores, particularly hindgut fermenters. And if you know anything about brewing, if you add a whole load of sugar, then the yeast, often in brewing, will go absolutely mad and produce lots of gas. And in a very simplistic sense, that is what can sometimes go wrong in our horses. So back to these animals here. So we've obviously talked about the sheep being a foregut fermenter. We haven't touched at all on carnivores, but obviously a cat is mainly a carnivore. Pigs are very much like us, omnivores. Camelids here are foregut fermenters, I don't know much about them, so don't ask me any questions about them, but they are not the same as cattle and sheep, but similar. So the answer is rabbits. Rabbits are hindgut fermenters like horses. And just in case you come across this in a pub quiz, other animals that are hindgut fermenters are koalas and rhinos. So we've had a quick anatomy lesson. So we're going to go on to the most common gastrointestinal problem we see in horses, which is colic. Now, colic just means abdominal pain or bellyache through any cause. Now, most of the time when we talk about colic, we are talking about bellyache due to gastrointestinal problems, so specifically the intestines. We all dread colic, every single one of us, and I think we all know that it can be life-threatening. One of the take-home messages from this is I want everyone to remember that at least 90% of colic cases that we see will be cured with very simple management and don't require any surgery or anything more invasive. So how common is colic? There's various different estimates in the UK. Various studies have come out looking at different numbers of episodes per sort of 100 horse years. So there's a bit of a range, but if you've got 100 horses on a yard, you might expect 3 to 10 episodes of colic in a year typically. And we do know that once horses colic, they are much more likely to colic again, and about a third of horses will colic again within a year after having a single colic episode. So I put the pictures up here of horses rolling. I think we all know that horses with moderate to severe colic will roll around with their abdominal pain, but there is a whole wide range of different signs that you can see, from just being a bit off colour, maybe eating a bit less, and it can be breed variable, it can be individual variable. So don't like to stereotype too much, but a thoroughbred might think they're dying and rolling around in absolute agony with just in inverted commas a bit of gassy colic, whereas a cob might just be picking at their food and off colour a bit and might have some serious colic. So I think if any doubt, pick up the phone and ring your vet for advice. None of us mind talking through what is going on, and then we can give you tailored advice for what's going on with your horse. So if somebody rings you and tells you your horse is colicking, or you see that your horse is colicking, ring the vet for advice. And then safety, human safety is absolute paramount. So if it is safe to do so, and you want to get your horse out to a safer place, so that might be a school or a paddock where it's less likely to injure itself, please do so. But just be wary of horses in pain, might do things that they wouldn't normally do. One myth I really want to just reiterate here is that you do not need to stop your horse rolling. Rolling does not cause a twisted gut or a surgical lesion. So if a horse is just lying quietly, please just leave them, take the food out and ring your vet for advice. But if their horse is at risk of being cast or being injured, if you can, move to a safer place. If not, just leave it where it is. Walking can help shift gas and things like that in a lot of cases. So if that is safe to do so and your vet is happy for you to do that, then obviously that can be helpful in many cases. So as vets, when we arrive with a horse that is showing signs of colic, we're going to do a very quick veterinary assessment, and this might be very quick if the horse is very painful. So there are lots and lots of different types of colic, at least 60 types of colic. So what we're trying to do is not necessarily diagnose exactly what type of colic is going on, but we are trying to differentiate and work out the best course of treatment, and differentiate between cases that we can deal with and give treatment at the yard versus do we need to send the horse into a hospital or a clinic for more extensive treatment. So the first thing we will do when we get there is just take a quick history from you whilst looking at the horse. So I can see this horse on the left here has got some sores above its eyes. That suggests to me that that horse has been colicking for a while and it's been probably quite painful. We will ask you some questions like when did you last see your horse normal, any change that might be relevant, so change in management, change in field, change in with worm recently, that kind of thing. And we will always ask you about droppings because this is useful information and might help us. But I just want to stress that it's not the be all and end all. There are plenty of serious surgical cases that we see that will have just done a normal dropping recently, but it is useful information to have. So we will carry on and do a clinical exam. And so here we are trying to piece together lots of pieces of information to get a better picture. So there are always exceptions to the rule, but generally more serious or surgical colics that would need surgery in order to fix them will tend to have higher heart rates. They tend to have no or reduced gut sound noises that we will listen to on both sides. We will look at their colour to give us an indication of if there's any degree of dehydration, and also how sick the horse is. So as bits of gut become compromised in the abdomen, horses can become toxic and become quite sick, and sometimes you get this purple line above their teeth on their gums like this. So we will be piecing all these pieces of information together. Other things that we will probably do, depending on the situation, is we'll often do a rectal examination, and there we are just having a feel inside to see if we can feel any piece of intestine that is in the wrong place, but perhaps is filled with gas, or the small intestine is really hard to feel normally, and if it is diseased in any way, it often fills with fluid, and if once it starts to become dilated and full with fluid, then we can often feel it. So we might not know exactly what we're feeling, but we might feel a piece of large colon that is in the wrong place, filled with gas, and we know that is an indication that we need to get that horse off to somewhere with hospital facilities. We might also be feeling for things like impacted food. You may have seen vets pass a stomach tube. So what we're doing there is checking to see how full the stomach is. So horses can't be sick. And if there's a problem with their small intestine, fluid fills the small intestine and can't get through and backs up, and that can back up and fill the stomach and make the stomach very large. And that is in itself is painful, in addition to the primary cause of the colic. So we might pass a stomach tube for two reasons, more than two reasons, to see if there is any extra fluid in the stomach, and then we can let that fluid out, which will provide some temporary relief. We might also pass a stomach tube to give fluids into the stomach if we've got, for example, an impaction colic. We will take some blood in, not necessarily straight away, but if we've got a case that we want to do some more investigation on, we will take some blood and we can look and see how dehydrated, things like lactate, which measure how good the circulation is and whether the horse is getting sick from any bit of compromised gut. The picture on the top right is taking some fluid doing peritoneal analysis, so of the fluid that surrounds all the intestine. So this should be a nice straw colour, and straight away from that picture there we can see that there is probably there is going to be some compromised gut in there, a bit of gut that has no blood supply and is at the dying off, and we need to do something about that. We can also test this and check things like white blood cells, protein levels, lactate levels, which give us an indication of the health of the intestines. And we also can ultrasound, looking for any intestine that's in the wrong place or what is filled with fluid. And we can do that very, very quickly. So it's a very useful thing to do. So majority of the time, though, more than 90% of cases that we go and see will be spasmodic or gastric colic. So these are cases that they can be quite painful, but it is something that has possibly upset the microbes in the hindgut, and maybe that they've just produced a lot more gas. There is a link with tapeworm and this type of colic. So it might be that the horse has a high tapeworm, which we're going to come onto it towards the end of this talk. And some horses are just more prone to spasmodic colic. So I often liken it to IBS in people. We don't know why some horses are more prone, and some horses changing in field or switching batches of hay or haylage is enough to set this off. And anything that can upset those microbes can lead to spasmodic or gastric colic. Another type of colic that we can usually deal with without doing any kind of surgery is pelvic flexure impaction. So this is where food material dries and there is a blockage in the colon. And from this picture here, I don't know if you can see my cursor, but we've got the left ventral colon, this sort of succulated part of the large intestine here that goes uphill, narrows, turns 180 degrees and turns into the left dorsal colon. And we can see here, this seems to be a bit of a design flaw. So if the food suddenly becomes more drier, or there is a lot less movement, so going on to box rest, for example, is a big risk factor, or when it gets very icy and cold and people don't turn their horses out as much, this would be typically where you get an impaction. So this is treated with fluids, nearly always via stomach tube, which may need to be repeated several times. So we can do that either on the yard, or sometimes horses do need to be hospitalized, but most of the time this is not life-threatening. Most of the other types of colic, which only account for less than 10% of the cases we see, need to have surgery to physically put the intestine back into the right place, or reposition displaced intestine or free trapped intestine, and then remove possibly bits that are compromised, that aren't viable. Sometimes we end up taking biopsies and things like that at surgery. So there are lots and lots of different examples, and I was just going to show you a few, but this picture here shows some small intestine coming along here, and then this is one thing that we see very, very commonly up at Ashbrook Equine Hospital and around the UK. You can get little lipomas, which are little fatty lumps that don't cause any issues normally in the abdomen, and they're on a stalk, and then this stalk can wrap around the intestine. And you can see here that this part of the intestine here, then the food material in here can't go through, but also it's the blood supply to this bit of intestine is completely compromised, and this bit of intestine will start to die off, and that will make the horse very very sick, as well as very painful. So here is some pictures from in surgery. You can see that this is it's not viable at all. The good news is for the small intestine is that we can remove the non-viable intestine and re-plumb it back together. Although there is obviously risks with doing that, and the small intestine, there can be some complications after if it's been handled for a long time and things like that. So here is where it's been sewn back together. So examples from the large intestine. So there's lots of different ways that the large intestine can get into the wrong place, but the cecum here on the right and the colon is basically anchored at the top of the body wall in one place, which means that this is completely movable. So it should, although the small intestine can go off and move around, this should sit in this location here, and this and like this. So as soon as it starts to move and goes into the wrong place, it's going to have compromised blood supply. Gas is going to build up. It's going to be incredibly painful, and if they don't get the horse into surgery pretty quickly, then the health of this is not viable to continue. And unfortunately, it's much harder to remove portions of large intestine than it is small intestine. So here's just another example. So these videos are freely available on YouTube, so I'll put the link there for anybody that wants to go and have a look at them. So it fills with gas, and then the blood supply means that it starts to die off. I'll just let this one play one more time. So I think it's worth thinking, while you're not in a very emotional and stressful situation, about what you would do with your horses or horses. So I just put this picture here of one of my colleagues, Abby. Is her trademark. She is a big fan of silver spray, and this horse is recovering from colic surgery, and she likes to put her heart on them. Not that that changes the prognosis at all, but so thinking about your horses, when decisions need to be made, they need to be made quickly, because if your horse has a surgical lesion, a lesion that needs to be physically put back in the right place or unstuck, the longer it takes to get to surgery, the worse the prognosis is going to be. So we will often be putting you under quite a lot of time pressure to make decisions quickly. So it's worth having a think about. There is obviously a significant risk of anaesthesia, but actually the risk of not doing surgery is, well, the only other alternative is euthanasia. So that doesn't come into it so significantly. But there is a prolonged recovery of several months. They usually depends on exactly what they've had and what so the surgeon that does the surgery, but they're likely to be in a stable for at least a couple of months. Survival has improved over the last few decades, but there are still, sadly, occasions when there's just too much compromised gut, or it's in a very, very difficult location. And my condolences to anybody listening that has lost a horse to colic. It is heartbreaking. So the prognosis, though, does very much depend on what you find, what the type of colic is, and what you find when you get in there, as well as how quickly they get to surgery if they need surgery. So every hospital's got a slightly different caseload, and people travelling different distances and things to get there. But one study in the UK, quite a few years ago now, but sort of is what we find is about 70% of horses will survive to discharge. Once they are discharged, then they have a good long-term prognosis. With this study found 85% survive to 12 months once they've been discharged. Finances are obviously come into it, and I think it depends where you are in the country, but we, as an example, will often quote people about £3,500 to £5,000 for the actual surgery, which sounds like a lot of money, but it's at least 4 qualified professionals. So you'll have a specialist surgeon and an assistant surgeon. You will have a veterinary anaesthetist, and then a veterinary theatre nurse as well. And they tend to be on the table for about 1.5 to 3 hours, and then the recovery time on top. So it is a lot of people and a lot of time. And then after that, you're looking at about £1,000 to £3,000 worth of intensive care, depending on how much intensive care they need. And that will depend, like if a lot of say you need to do some replumbing, you need to take some small intestine out and replumb it together. The intestine, that takes longer, but the intestine might take a little while to get going after surgery, and the horse will need a lot more intensive care. So the reason I'm just discussing costs now is that actually a lot of the time, majority of our clients have veterinary insurance for up to £5,000, and this often just goes above that. So I think it is worth just having a think about what you would do, and maybe even chatting to your own vets about it. So on our whistle-stop tour, we're now going to move on to gastric ulcers. People often ask, actually, do they cause colic? And there is definitely an association. So about over 80% of horses with recurrent colic in one study were found to have gastric ulcers, but they are very common anyway, which is what you'll see in a minute. And it's hard to know cause and effect. But actually, in another study, about 28% of horses that had repeated bouts of colic improved after improving their ulcers. So it's not as direct a link as we might think, but definitely something we would look at. So anyway, talking more generally about gastric ulcers, you see there I've called it a syndrome. It's not just one disease process. So the horse is very unusual in that it's got these two distinct parts to its stomach. So the top part is this paler bit, which is lined with, the lining is called squamous, it was lined with squamous cells, so we call that the squamous mucosa. This doesn't have any glands. It's really an extension of the same lining that comes down from the esophagus. And then down the bottom, we've got this glandular mucosa. So this is a bit that's got similar to our stomach. This part produces the gastric acid and some mucus and enzymes and things like this. And in the horse, we've got this very, very distinct junction between the two layers. And that junction is called the margo plicatus. Now, this top part, the squamous part, is not very resistant to acid, which sounds very much like a design flaw in a stomach. But what we have to remember is that horses have evolved to eat mainly roughage and eat almost continuously. And so in a normal horse's stomach, you will have a fibre mat. So what you'll actually find is that the pH at the top of the fibre mat isn't actually that acidic, and then it'll be very acidic down the bottom. So if we have any acid injury coming from the bottom, splashing up onto the squamous, or from here coming up and splashing up to the squamous here, this is when we will get some squamous ulceration. So I've put a picture of a racehorse here because we know a lot of things about the risk factors for squamous. And if you're a racehorse, you are very high risk. So different studies find different things, but at least somewhere between 80 to 100% of racehorses, depending on which study you look at, that are in training will have some degree of squamous ulceration. Sports horses, less so, but still varying numbers, but up to about 2/3. But even happy hackers that are having a nice life and very little stress, still about 1 in 10 horses will have some degree of squamous ulcers. So the risk factors that I talk about are intense exercise and high starch, low forage diet, which I'm sure Katie will talk about a bit more, and also stress. So if you think of a racehorse, you probably have all those risk factors, but we do see this in lots of different types of horses. So the ulcers tend to be around this margo plicatus area. This picture on the left is actually slightly sideways, so left is up. So they tend to be just above this distinct margo plicatus line, and on the lesser curvature as well. So here on this picture, we'll see it in the next slide, but you can see our scope coming in and it's come round, and then the outflow is out here, but we often get some ulceration just there as well. So there's a recognised grading system, grade 1 to 4. Grade 1 often or typically doesn't cause any signs. So they might just be an incidental finding. Grades 3 and 4 nearly always likely to be causing some symptoms, and this can include irritability, girthiness, very picky or slow eating, poor condition, and just in general poor performance, a horse not performing to the level that you expect them to perform at. The other type of ulcers that we see are glandular ulcers, or equine glandular gastric disease, and this is down the very bottom of the stomach, typically around the outflow. So on all of these pictures here, you can see a hole, and that is the pylorus that then goes on into the small intestine. A lot less is understood about the risk factors of glandular disease. So it's really hard to give specific advice for prevention because we don't really understand all the different risk factors yet. And I think we do see a variety of appearances from raised, just red lesions to bleeding lesions to sort of flattened. So there's probably a variety of disease processes going on. What we do know is that warm bloods are overrepresented. So in one study, there was about 2/3 of sports horses had some degree of ulceration in this area. It is also thought by some that it's not high intensity exercise that will lead to this type of ulceration, but frequency. So making sure the horse has at least a couple of days or very easy days or rest days can help. So the only way to rule in or rule out gastric ulcers of either type is by gastroscopy. There's been various fecal tests looked to try and assess whether there's any gastric ulceration, but they're really not reliable enough to be confident in the results. So in order to do a gastroscopy, I'm sure many of you will have had horses that have had this done. The horse needs to be starved because we need the stomach to be empty of the fibrous material so we can get down to the bottom of the stomach. I always say that I think the starving is the worst part for the horse. The actual procedure is a very safe and benign procedure. And I think we have to remember that horses don't have the strong gag reflex that we have. And so actually we often only give a very small amount of sedation, often less than we would give, say, to do a dental, just to facilitate the passing of the scope up the nose, which is the bit they don't like really. Once we get into the stomach, we'll fill it with some air so we can see it a bit better, and wash off any saliva and food that's stuck to the walls. And then we'll have a good look around, and then we will go round and go down to the pylorus. So if you come in through this esophagus and then you have to go and come round and go back on yourself and then go under where we came in to get down under towards the pyloric area. There is a very, very small risk of colic with this procedure, but as long as we suck out all the air that we put in at the end, the risk is absolutely minimal. And there is also a small risk of a nosebleed, but that bothers everybody else more than the horse. So the exact treatment depends on whether we're looking at squamous or glandular ulcers. The mainstay of both, though, is to reduce the amount of acid, and there's various different omeprazole products which will help reduce the amount of acid. Squamous ulcers usually heal pretty quickly, usually heal within 3 to 4 weeks. Glandular can take a lot longer and require a combination of drugs. So sometimes we will add in sulcralfate, which sort of sticks to any ulcerated mucosa, and there are other drugs like misoprostol. There are loads of gastric supplements out there. Most of them, there are various different ones, but most of them are based on antacids to neutralize the acid, which, because horses produce acid all the time, is not as effective as it, say, I don't know, us taking a Rennie tablet. The antacid supplements will usually last for about somewhere between half an hour and an hour. So they have a short-term effect, but they might be useful in that short period. So if you want to feed it before exercise or with a meal. So the main thing about squamous ulcers is to try and encourage more forage intake. And that doesn't just mean just giving them ad lib hay, and because often they are, or horses with squamous ulcers will often be picky or slow eaters, and I know that Katie will cover this more in her talk. So hindgut disease, there are absolutely loads of things that affect the colon. We're going to talk about parasites in a little bit. The inflammatory bowel diseases are when there's a whole host of different cells that can cause thickening of the gut colon wall, cause protein loss and weight loss, and prognosis very much depends on what type is going on. Sand can irritate the gut and build up in the colon, and that in itself can lead to colic. Colitis is well, itis just means inflammation of, so colitis just means inflammation of the colon. So colitis usually results in severe diarrhea. It can be life-threatening, and there are lots and lots of different causes. And right dorsal colitis is a specific type of colitis that can be a side effect of bute, or the other family, non-steroidal anti-inflammatory drugs family that bute is in, so like metacam as well. Relatively rare, but they can present with low protein because they end up with a leaky gut. So the problem with hindguts is that it's really difficult to assess the large colon. We can ultrasound and we can have a look pretty much up to about 30 centimeters maximum from the body wall. And so with our ultrasound scanner, we can assess things like wall thickness, but it's really difficult to get a camera in and have a look at the colon. So there are various people that have tried pill cams, so getting the horse to eat a pill with a camera in it to try and assess their hindgut. And several colleagues have done that in horses, and with varying results. So it might be something that we do more of, but I think at the moment we're a bit limited by what we can do to see in there. I just wanted to go into these last three things in a little bit more detail because I often get asked about them. So people often ask me about hindgut acidosis, and I don't know if it's a true acidosis in the true sense of the term, but there is definitely a scenario where the horse is maybe fed a high starch diet, and they can only digest a limited amount, and a lot of starch then gets to the hindgut, and basically, I'm going to use that term again, upsets the microbes in the hindgut, causing some issues. So yeah, that is a problem with too much starch and not enough fiber, and then ending up with too much sugar to those microbes. So I'm just going to talk about free fecal water and hindgut ulcers. So free fecal water, this is where you have completely normal droppings that you can pick and pick up, but there's like an extra squirt of water around the normal droppings. And this can be really messy and frustrating, and it can cause a bit of scalding on the black legs. But it's not really a clinical problem. It bothers people more than it bothers the horse. And the problem when trying to get rid of it is we don't know what the cause is. There's been various things looking into trying to work out what the cause is. But what we do know is it is often linked with change in the diet or the forage source. So we will often suggest changing the forage source, and that might be simply from switching from haylage, say, to good quality hay. And that can often help. It is always worth checking the teeth at this point in time as well, but it is likely to be a sign that the hindgut is not happy. So we really need to look at the fibre source for that. There may be some merit in feeding pre and probiotics. So probiotics are like feeding the equivalent of like your Yakult yogurt, but actually how much gets down to the hindgut is very questionable. Prebiotics is feeding things to help the microbiome. So your fructose, oligosaccharides and things like that to try and help those the microbes in the hindgut. And I think this is an area that the knowledge is expanding really quite rapidly. We know that the microbes are so important for gut health, and in humans we know that they're linked with the microbiome is linked with a lot of other non-intestinal diseases too. So it's kind of watch this space with horses. There is already, and has been available for a few years, a commercially available test, but what we don't know, we don't have yet is the clinical relevance of that. So I think it's watch this space, and we are actually involved in a study at Ashbrook with the University of Manchester, where we are taking fecal samples from all horses with ulcers, colic, diarrhea, and they are trying to look at biomarkers and look at the microbiome. Hindgut ulcers is one that we hear a lot about. Many vets will actually question whether this is a real disease. Now, I think that there are definitely horses that have hindgut ulcers. There have been post-mortem studies where they've looked in the colon and looked for ulceration. And in one study, about 20% of horses at an abattoir had some degree of colonic ulcers. Majority of those, I think it was 3/4 of those, were due to either parasites or sand. So it's definitely worth doing fecal worm egg counts, checking the worming status, and ruling out sand intake. And if we're concerned about sand, we can sometimes see image the abdomen and see sand, but one of the simple ways to see if sand is coming through anyway is just to take a fecal sample, put it with some water in a glove, and let's see if any sand settles out. But as I said, it's really hard to actually access the colon and look at the lining of it. So we can ultrasound. We will often gastroscope and have a look at the glandular area of the stomach, because sometimes we do see diffuse problems throughout the entire gut. But I think it's really hard to definitively diagnose hindgut ulcers. So if we genuinely are worried about it and we've looked at the worming, we've looked at the sand, we might take a blood sample and check something called albumin, which is a blood protein, a very small protein. And if the gut is leaky, they will lose that protein. So that can be helpful to give us an indication of the health of the colon wall. We will often look really at the forage source and nutrition, and in some cases there are drugs that we can almost do as a bit of an experiment to see if that helps. So I'm just, as I said, this is a whistle-stop tour, but we can't talk about gastrointestinal health of horses without touching on worms and worming. And I just want to talk a little bit about responsible worming, due to the, I'm sure you are all very aware, there is a very, very real threat of resistance, and none of our wormers working in the future. It is the majority of wormers that get sold in this country are given to adult horses, but actually it is young horses which it's most critical for, and it's young horses that most commonly die of worm-related diseases. So I like to keep things simple. There are 3 types of worm that cause significant disease in horses, and which we really need to consider when thinking about how we need to worm. So the first is tapeworm. I've already put a picture up when I showed you spasmodic colic. These guys live at the ileocecal junction, so that's where the small intestine joins onto the large intestine. And as I say, there's been an association with colic, but many horses have quite a few tapeworm with absolutely no problems whatsoever. And I've just put a picture of a mite there because the life cycle goes through the horse, but it also goes through this mite that lives on the pasture. So, and this mite likes lush, green, wet, damp pastures, so typical of the UK really. So tapeworm is one type of worm. The next type of worm that we need to consider is redworm. So these are the small strong guiles. Pretty much all horses will have some of these. We can never eradicate them completely. So there are several stages to the life cycle. So the horse will pick up eggs and larvae off the pasture. The larvae then they go through several stages of the larvae in the colon. They can insist, one stage of larvae can insist in the colon wall, typically over the winter. So I like to say they hibernate in the gut wall, which is this picture on the bottom right. And then if those all emerge and turn into adults all at once, it can cause severe diarrhea, which typically you would see in young horses, and that can be life-threatening. And when that happens, you often see some larvae pass, like on the picture here of my glove of a young horse with diarrhea. So this is larval cystostomiasis. Adult horses can have quite a high worm burden of this without having any problems, although it can affect adult horses too. So then the third type that we really worry about is ascaris. The good news about this is this only affects young horses. So most adult horses won't have any ascaris at all because they get an immunity to it and can clear the infection themselves. But it can cause severe blockages in the small intestine, and we do lose foals to this. And I would urge you, if you're eating your dinner and having noodles or perhaps spaghetti, to look away now, because I'm going to play you a video of a poor foal that has a very severe impaction due to these ascaris. So, yeah. So there, we need to think about which drugs we use and why we shouldn't just worm all the time. So I'm just going to explain how resistance occurs. So I've made a little schematic to show how this happens. So all horses have some worms in them. So imagine the blue worms are the normal worms, and the red worm here is a resistant worm. So this worm here, either by chance, by just absolute mutation chance in the animal, is resistant to a particular worming product, or it may have been picked up by off the pasture from another horse that has been passing resistant worms. So we've got one red worm and we've got quite a few susceptible worms, but then we give our horse a wormer. Now, wormers aren't 100% effective in typically. So you will kill off most of the susceptible ones, but not all of them. But you definitely won't kill off the red worm, or the one that is coloured red. It's not necessarily a red one. And then as the horse grazes and cycles around, the numbers build up again. And now we've got still the majority susceptible worms, but we've got a few more resistance worms. And then it's time to worm again. So we worm again and we kill off all the susceptible worms, all the blue worms go, but actually we leave the three resistant worms, and then they cycle up, and before we know it, we've got an entire population with resistance. So basically resistance occurs because every time we give a wormer, we are putting selection pressure to allow the ones that do have the resistance to survive. So the more we worm, the more likely we are to have resistance. There is also some bad news that resistance lasts. So once a horse or a pasture or herd has resistant worms circulating or cycling around on it, that resistance is likely to last for a very long time. There's been documented evidence of resistance in horses that have had resistant worms and then not been given any wormers for over 20 years, and 22 years later they still had resistant worms in them. So we have to assume it will last pretty much forever. And the other bad news is that there are no new wormers coming out onto the market. So we need to use the wormers that we have responsibly and make sure that we only use them when we need to use them. So, but there's loads of wormers, right? When I was doing exams and stuff in the 1990s, I'm talking pony club exams and things like that, BHS, we used to say rotate your wormers. Well, that's great because there's loads of products, is what a lot of people think. But actually, I just asked my friend who is an SQP to send me what they stock on their shelves, and those two are the same drug. So those are both Parantal. We've got Fenbenzol and Panicure. All of those have exactly the same drug in them. They are all ivermectin. They just have different trade names. And then we've got moxidectin. So moxidectin in the orange and ivermectin in the red are, although they are different drugs, they are in the same family. And then we've got combination worms down here. So these three at the bottom in the purple have got praziquantel for tapeworm in them as well. So if we think about roundworm, so those are those horrible ones that look a bit like noodles that only occur in young horses. What can we give? Well, we don't need the praziquantel because that is only for tapeworm. So what options have we got left? We've got the rest of these according to what it says on the tin, on the box, but actually there is almost 100% resistance already for quite a few years in this country to ivermectin and moxidectin, and quite significant resistance to parental. So the only really effective wormer left for roundworm is fenbendazole, which is found in Panacur. So redworm is a slightly different picture. So the opposite way around, in that the fenbendazole and Panacur is there is almost ubiquitous resistance in the UK. So although it says on it, it treats redworm, it does not. And this used to be the one that we gave 5 days for, you know, really good strong wormer to clear out redworm. Well, it is, you might as well just be tipping it down the toilet. It's very ineffective at the moment in the UK. Parental is, there is resistance already in the UK, and it's a bit variable. So it is still quite effective in some places, but on 70% of stud farms in one study, there was significant resistance. But not to worry, we've still got moxidectin in the orange and ivermectin in the red. But both of these products, yes, they are still currently effective, but they are working for a lot less time than they used to work. So the moxidectin, when it first came out, lasted at least 12 weeks. It was licensed to be given every 3 months, but now it is only lasting typically in the UK about 4 weeks. So we are running out of options for redworm. So yeah, we have to use our wormers responsibly. And the key thing is that, well, we often say 80% of the worms are in 20% of the horses. It is very, very variable as to how susceptible horses are. You can have 10 horses that are the same age, same breed, same sex, same everything on the same field, and you will find that 1 to 2 of them will need to be wormed regularly, and the other 8 or 9 don't. And you can't tell by looking. It doesn't. You can't tell. You know, they're not necessarily the thin ones or the ill ones. So if you're not doing it already, I urge you to all do worm egg counts every 2 to 3 months throughout the year. This will mainly tell you about redworm shedding and help reduce the load going onto the pasture. There's also the Equisal tapeworm test kit, so the saliva test that you can, and also a blood test as well that you can do for tapeworm. Historically, and still a lot of the time, we will recommend an autumn wormer, an Equus pramox, which will get both encysted redworm and tapeworm. But actually, for a lot of horses that are low risk, that is overkill. So I would all talk to your vet. It's all about risk. And if you have adult horses that aren't great with young horses that are in their own paddocks, and you poo pick twice a week, probably they don't even need that. So talk to your own vet about testing and whether you need to actually give that autumn redworm test wormer. So young horses is a different kettle of fish. We do need to do some targeted worming for them because they do get severe disease with these issues. So testing sounds really expensive, but it is nearly always cheaper than just worming every few months, as well as doing the right thing, trying to reduce the chances of resistance. And it also has massive environmental benefits. So we know that when we give wormers to horses, the products come out in the feces, and that can affect the invertebrates and the biodiversity and get to water sources and things. So, but the most effective thing that you can do, and I know this is not practical for a lot of yards and a lot of people, but if you pick up the feces at least twice a week, it breaks that cycle, and that is more effective than any wormer even historically, and it's the best thing you can absolutely do. So I think that's the end of my whistle stop tour. I think that with the exception of the topic of worming, the take-home message is pretty much fibre is your friend, which I think leads nicely on to Katie's talk. I've put my email up there. I'm obviously happy to take questions at the end. I'm also happy if anybody wants to email me, please do. It might take me a little while to get back to you. And if it's specific about your horse, I will just direct you back to your own vet. But if you've got any general questions, I'd be more than happy to take them. Thank you very much.
Brilliant, thanks, Julian. Thank you for covering the resistance topic so graphically. That's brilliant to get a really important message home to people, because yeah, it's quite serious and concerning to think that there might not be wormers are useful in the future. A bit like antibiotics, really, but thank you for that. Let me just share my screen. So, feeding for digestive health, really, and what I would like to try and sort of cover is the importance of fibre through the digestive system, and then trying to work out the right fibre source for the right horse and helping you select the right product for your particular individual, and also the approach to reducing the risk of diseases that Julia has brilliantly outlined for us in terms of ulcers, laminitis, colic. What can we do strategically in the way we feed and manage our horses to try and reduce the risk of those diseases. And for those of you that have been brought up doing pony club exams and BHS exams and things, then you will have the rules of feeding drilled into you, I'm sure, at many a rally, and they are existing for a reason. They're there because they help to reduce the risk of disease, and that's why they're so important and stand the test of time. So a lot of this is building on that and hopefully giving you a bit more of the explanation as to why those rules are so important. So we always like to start these talks, just as Julia did really, with a view of the digestive system and how it compares and contrasts with other species, because slides got a mind of their own. Because the horse is a horse, and as Julia really brilliantly illustrated, it does have a fairly unique digestive system. There aren't many animals, certainly those that we encounter on a regular basis, that have a similar digestive system. So whilst research does exist in equine nutrition, we're usually trying to extrapolate studies from other species or in other species, because there is more work done in animals like cows and dogs and cats, etc. So it's trying to apply the principles of what we know about the different digestive systems and what we can take logically and sort of with an informed view apply to the horse, as well as obviously information that comes directly from equine research. But the key, as you can see there, is the horse has a really small stomach relative to other species and the rest of its digestive system. And really the sensitive hindgut, which is the cecum, that sort of big grey blob in the middle of the screen with a red star, and the large colon, large intestine, the sort of hindgut area tends to be the most sensitive in the context of the microbiota. But as we're going to explore in a bit more detail, there is more evidence emerging to show that bacterial populations and other microbes, for that matter, exist throughout the digestive system, and they may well, and we probably don't know yet, just the significance of their role in overall health and well-being. So just some new thoughts perhaps to consider and take away, as well as what we know to be a little bit more established. So we actually start the digestive process with a mechanical or a physical breakdown of food. So the horse's mouth, in effect, so the teeth, the incisors at the front and the molars. I don't know why that's going to doing that, apologies. They are responsible for getting the food into a size that the animal can actually swallow and starting that digestion process safely. And you're probably all familiar now with the fact that the horse is a herbivore, and therefore it should be eating for around 16 to 18 hours of every day. And it is that chewing that's vital for saliva production. So if we can keep the animal chewing, then it's actually going to produce more saliva. So around 10 to 12 litres of saliva is typically produced daily. And that contains bicarbonate, which is where some of the buffering is basically achieved or starts from keeping the stomach healthy as well. So if we're producing more saliva, it goes through into the stomach, and that's where it's neutralizing some of the acidity and helps to regulate the acidity level in the stomach. But obviously if the horse spends less time chewing, we get less saliva, and that's one of the reasons why acidity levels can increase in the horse's stomach, which ultimately may increase the risk of ulcers, as Julia showed you. Now horses do spend more time chewing the sort of forage material, so around 3 times as many chews are required for a kilo of forage compared to the concentrates. Now obviously we can increase the time the horse spends chewing its bucket feed by putting sort of chopped fibres and potentially other fibre sources in there If horses can't manage chop, then we can actually put things like mashed fibre in, which may help as well to slow them down a little bit. But it's the chopped that really helps to increase chew time. And that's why we're adding it if we are going to use any form of cereal-based feed, to try and extend that eating time as well. There have been some studies to show how much more activity or strength or pressure is required to to chew forage. Eating hay and haylage was actually associated with much more intense activity of the cheek muscles compared to eating cereals. And the researchers in that study actually found a correlation between the amount of pressure and the amount of saliva produced. So in simple terms, the more we're going to get them to chew these fibrous materials that take more effort effectively, then the more saliva we'll have produced. And when you think about it, compared to something like a carnivore, if they're eating animal cells, tissue, flesh, whatever you want to call it, the cells of us are actually only just membranes. That's all that surrounds them. When we actually look at plants, we have a cell wall. So the structural material of that wall is actually stronger and harder to break down and chew, if you like, than actually animal material be. So the herbivore needs to apply more strength and pressure to actually physically break down the tissue itself when they're eating plants than they do if they were eating flesh. So that's an important concept that we don't always appreciate, just how tough a structure fibre actually is and requires a lot of chewing. And that's why looking after your horse's teeth are so important, or is so important. We've also had some studies, and again, these are limited numbers of studies, but they do give us an indication of the amount of activity and also the range of movement that the horse needs to put through its jaw to actually chew different feedstuffs. So with this fibrous material, because it's so difficult to break down, it's quite tough, the horse is A, using more pressure, but B, also using the full range of movement of its jaw, or it's more likely to. And it's that full range of movement that the researchers in this study suggest are really down to, or really helps to reduce the risk of enamel overgrowths or sharp edges that we might see. Now, obviously, you can manage your horse by having a dental technician or your vet come and remove those overgrowths and sharp edges. But if we can use more of fibrous-based materials in the ration, encouraging the horse to use those slower, larger movements when chewing, yes, it's going to take longer, it's going to apply more pressure, and hopefully the reduction of these overgrowths will be a result as well. Some of the signs your horse may have poor dentition. Now, some of you may well have experienced seeing these sorts of quidding or balls of food that have been chewed and then dropped out. You might see them at the bottom of the hay net. You can also see them in pasture as well. That's a very obvious sign, and usually is an indication that there's quite a serious dental problem going on. Also, you might see problems with them actually trying to swallow it, so choke, which if it's recurrent and occurring frequently and more frequently, then it's a good indication there is a dental issue. Some of the perhaps more nuanced things and require closer inspection would include things like the length of fibre coming through in horses' droppings, so in their poop. There has been a level or length at which it's been proposed as to being an indicator of the presence of dental abnormalities in horses, so more than 3.6 millimetres in length coming out the other end. And I think it's interesting that the researchers compared this with donkeys as well, because donkeys are more stoic, so they tend to not exhibit pain and issues generally as much as horses do, and they have a slightly different anatomy in their jaw as well. So the researchers in this study suggested that actually a shorter length of fibrous particles coming through in the poop would indicate a potential issue for them. And the reason that's important to highlight, I think, is because they are stoic, you have more risk of impactions and colics in particular becoming very, very serious before you can sort of treat them perhaps medically, because they aren't giving you any signs of pain. So looking for subtle signs like length of fibres in the droppings is a good indicator, a good marker that perhaps the dental issues may be meaning that they're swallowing larger pieces of forage than they should, and then the potential risk for impactions and problems through the digestive tract is increasing. And one of the things that is also often overlooked is just how long it's taking horses to eat if they have poor dentition. We've done some studies over the years with older horses with poor dentition, comparing them to others that have relatively good teeth. And they are eating, in some cases, up to around 2/3 less in the same time period. Now, if you're measuring your horse's allocation of forage out, you're watching them eat, you can see that they're consuming their allocation as normal, that's fine. But that's much, much harder to do when they're in a group situation. And from the outside, they may well be looking like they've got their head down and eating and spending just as long as eating as the rest of their group, but actually how much are they consuming? And if you see weight loss or other sort of signs that are indicating they're not doing quite so well, I guess weight loss, perhaps lethargic when you're riding, so they're not getting as much energy from their ration, they could all be signs that yes, they look like they're eating, but they're just not consuming as much as they perhaps would have done. And again, another good sign that some dental work may be required. So from the sort of mechanical, physical breaking down of food, we then move into the digestive tract, where we're relying on things like enzymes and much more of a sort of chemical breakdown of feed. And we've talked a little bit already really about the benefits of fibre for the stomach. So the fact that the stomach is rarely empty if the horse is allowed to eat almost continuously is a really important concept when it comes to discussing gastric ulcers and thinking about ulcers. I think it's always quite amusing when we used to do gastroscopy or gastroscopes, and you see these horses that are supposed to have been fasted overnight, and they've very often eaten things that they're not supposed to. As Julia said, it's the hardest bit for them not to actually eat, so bits of shavings and all sorts of things might have actually been consumed instead of their normal ration. But essentially what we're trying to do is keep this stomach with some food in, assuming we're not starving them or keeping them off food for a gastroscopy. And it is that saliva production that is helping to buffer acidity in the stomach. When the horse is actually grazing, the sort of pH or acidity level in that squamous region is usually around 4 or above. And that's the sort of marker that's become established really as the line we don't want to go below, or the level we don't want to go below, because we're associating it with an increased risk of ulcers. Now, in contrast, the glandular region, as you'd expect, because it's where the acids and things that are going to digest food are produced, in that region we're looking at a pH of around 2 to 3. So there is a gradation up the stomach in terms of acidity level. And you can see in the studies that have been done that the acidity will increase when you haven't got food going in there. Even within a few hours, the pH level is starting to change. Even when we have got food going in, the pH can adjust or alter. Timothy Hay, whilst we think it's a really good source of obviously fibre, which it is, it wouldn't be as high in things like calcium and other nutrients that might also help to buffer acidity as other types of hay might be. And that might be one reason why, even when they're fed ad lib, the gastric pH was still quite low. And it shows in contrast there how low it can go with the fasted horses, down to 1.5 on the pH scale. Squamous lesions have been found just after 7 days of bringing a horse off grass, even with ad lib hay. So again, another reason where we're seeing, even with ad lib, if they're not consuming as much because it's not as palatable as fresh pasture, it can have an impact on the amount of buffering that's occurring through the saliva production. So the type of forage that we're using or type of feed that we're using has an impact, as well as how much we're putting in too. And I guess the obvious one that we talk about a lot is alfalfa, which has a higher level of calcium and obviously helps to buffer acidity accordingly. So if we move on to the small intestine, horses aren't well adapted to high starch diets. So yes, we use starchy based feeds to put more energy into the diet, but we have to be very careful how we do it and the sort of quantities, and we'll come to that in a bit more detail in a minute. What we do tend to find as a result of using starch is, along with the potential reduction that might well happen because we're not putting so much fibre in, we're also seeing that the starch, when it's broken down, creates a more acidic environment in the gut as well. So research in other species has shown that the absorption capacity, or its brush border, is reduced when high starch diets are fed. And at last, we are starting to see that we have some studies that show the same is happening in the horse. So for many years, we've been applying the principles from other studies. Now we actually have some evidence specifically to the horse. But what is that brush border? Well, it's these little villi that you can see in this highly magnified sort of image on the screen, and they're the villi that protrude into the sort of lumen, or the hole through the digestive, through the small intestine, and they increase your absorption capacity in the small intestine. So if it was flattened out, all these villi, it's roughly the surface area of 3 tennis courts in the horse. So it gives you the scale of just how much extra capacity we have through having this brush border, or these villi. Obviously, we want to increase the absorption of things like fats and oils in this part, and also the starch from cereals in the small intestine. It's also the site of absorption for protein as well. And the reason that we want the starch absorbed here is because if it overflows and spills into the hindgut, gut, we have many more issues or risks of disease. And that's why it's important we're trying to increase this surface area to maximise absorption. We also know that there's 70 to 80% of the immune system is actually in the gut. So we've got lots of mechanisms by which the animal relies on its digestive tract as the barrier to entry to the rest of the body. So the acidity levels itself in the stomach will kill off certain bugs and pathogens. And then as we come through into the small intestine, we want a really impermeable gut to harmful bugs and pathogens, but a permeable gut to nutrients. So this is that sort of dynamic balance between the health and the efficiency of absorption of nutrients. There are particular types of cells called Peyer's patches in the small intestine, and certainly in humans, the levels of those sorts of cells tend to peak in around our 3rd decade. So once you're past 30, basically your immunity system starts to become less efficient. And for all of these reasons, because we want a healthy gut, we want a healthy immune system as part of the gut, we're trying to feed less starch so that we can keep the gut as healthy as possible. And even for a poor doer, the basis to the ration needs to be fibre, then we put some oils in, and only if that isn't sufficient to get the horse back into good shape and good condition, then we should really start to be considering the use of starch in moderate levels. So fibre needs to be the foundation of the ration, because we want a healthy gut to maximise absorption. And effectively, it's the digestive enzymes and salts produced in organs like the liver and the pancreas that are entering into the small intestine to try and break down nutrients. And the herbivore sort of tendency is for continuous or almost continuous eating, and so you've got an almost continuous production of things like acid in the stomach, bile from the liver, etc. And some animals can actually turn this off when fasting. The horse is not one of those. And when I read this, I thought I can put that note on here to remind myself to talk about it, but actually I don't really think that some horses can turn this off. It's other species completely. So a python, for example, is something that when it goes into a fasting state can actually control and reduce the levels of these digestive sort of juices that are being produced if it's not consuming something. At the other end of the spectrum, the horse is obviously almost continuous eating, needs the continuous production of these digestive secretions. And it's enzymes like amylase that break down starch. So the small intestine is where all this is going on. And there is some evidence to show that if we do feed a higher level of starch, then levels of amylase enzymes can increase. But this rate of change is slow. Everything takes time. And as I said earlier, this is where one of those basic rules of feeding comes in. We should make changes gradually. And it's to allow the body time to adjust in this context, the levels of enzymes to increase so the animal can cope with that higher level of starch. And just a little bit of food for thought, sorry for the poor pun, but we hear a lot about the sort of microbiota and the microbiome these days. These terms are being used increasingly in terms of human nutrition and the relationship between the gut-brain axis, and how all of these interactions can actually affect lots of things like our mood, our behaviour, as well as our health and well-being. And there's an international scientific association now for probiotics and prebiotics, which they do a podcast if you're interested in that sort of thing, and it covers all sorts of species, humans right through to pet animals. I've not come across one specifically on horses yet, but they have also issued new words and new definitions. So we now have things like postbiotics, which we'll probably cover in a later podcast or webinar. But these are things that we're starting to become more familiar with, because we are understanding how important the microbes that live in the gut are to our overall health and well-being. And even in the small intestine now, one of the researchers that was talking a few weeks ago saying, you know, the potential interactions between these bugs, even in the small intestine, however short a period of time they may be there, it can have a real impact on things like immune reactions. And perhaps seeing the digestive system models or diagrams there also, you know, it's a good indication or good illustration of where, you know, we have the stomach at this relatively early on in the digestive process. We then have the cecum, and they're big sort of sac-like structures relative to the tubes of the small intestine and the large intestine. And the reason for that is that they are trying to slow the rate of passage of food through the gut, so we can increase the time with which we can digest the food and get the nutrients from it. So, you know, the cecum really is designed to kind of trap that fibre long enough for bacteria and other microbes to break the fibre down. And, you know, that is an important concept, because it is a race against time, and the quicker everything passes through, the less time we have to get nutrition from the food. Again, there's Julia touched on the sort of inflammatory bowel disease. We know relatively little about it. It's still relatively little known in humans, never mind in horses as well. But there is some indication that it can be caused by components of the immune system, and they can cause changes to the motility, so an abnormal sort of immune response. And some of these immune products, I suppose, or products of the immune system, can actually start to try and block some of the absorption in the small intestine. And this paper that was published in the Equine Veterinary Education Journal suggested that then some of our non-structural carbohydrates, that's starch and sugars that we would want absorbed in the small intestine, comes through into the hindgut, and there is the potential for sort of colics and other issues as a result. So these are all sort of relatively new ideas or concepts and things that will undoubtedly become more commonplace and more frequently talked about in the next sort of 5 to 10 years. What can go wrong? Well, leaky gut syndrome. We've talked about trying to keep the gut impermeable to pathogens and harmful bacteria, but permeable to nutrients, and that's a really tricky balance to achieve. Why does it tend to go wrong? Well, often too little fibre. And just listening to webinars today, looking at pet nutrition, and they were talking about how we tend to underestimate the importance of this mucus layer. It's just mucus, we think, or it doesn't inherently seem something that's a really major important part of the immune system, but it really is this mucus layer that, again, is tending to be eroded. The higher the level of acidity or the more starch we're feeding, the chances are this mucus layer will be eroded. And there've been lots of studies, tending to be lab studies with using mice and rats and things, where if you take them off pretty much all the fibre in the diet, this mucus layer is eroded and the gut becomes more permeable, and we tend to talk about it as leaky gut syndrome. So it's just letting harmful things through, escape from the gut, and potentially cause disease and harm elsewhere in the body. And the other thing I always like to talk about in the hindgut is the fact that it obviously has a function for digesting fibre and that fermentation process, but it's also where a really high proportion of the lymph nodes are relative to other areas of the body. So the horse has a high number of lymph nodes relative to humans, around 8,000, and half of them approximately are in the colon. And because the lymphatic system doesn't have a pump, so unlike circulatory where the heart is pumping blood around the body, the lymph tends to work under pressure and sort of stimulation. So things like exercise and movement will help, but also the movement of the gut, because so many of those lymph nodes are in the colon. The fact that peristaltic movement of the gut is kind of pulsing and pushing, applying some pressure on the lymphatic system means it's clearing waste products from exercise, etc. So it's another reason that we want to try and have this horse eating as long as possible, because it's actually helping clear, sort of waste products from the body and promoting good movement of the lymph. So the more obvious, I suppose, the more commonly talked about things in terms of fibre fermentation going on in the hindgut are things like we need fibre just as humans do to keep us regular, keep everything passing through. That applies to the horse as well. If they start to consume less fibre, either because their teeth are letting them down and they can't eat as much, or sometimes it can actually happen in really hot countries because heat is a byproduct of the fermentation process, and it is literally the horse's central heating system. So if they are very hot, and this may start to apply more as we experience these really extreme temperatures in the summer, horses will regulate their own temperature by backing off some of the forage, reducing their intake. And we do see that in places like Dubai, and horses competing, they're getting hot and don't want to potentially eat as much forage as they would. So those are all sorts of things we need to consider. And I'm really sorry for the wordy slide. It's a lot of information in one place, but this key concept of, we know fibre is important, but how much is enough? Now, and I've already kind of talked about the sort of function it has through the digestive system, but we haven't talked about fibre as a nutrient as such. So we don't really know how much fibre the horse requires. We usually refer to how much forage as a proportion of the ration the horse needs, but we don't have a specific really level of fibre. So what we should really title this slide is we know fibre is important, but how much forage is enough, because the recommendations tend to work on the sort of forage based rations and how much of those we should be feeding. So if we go back 10 to 12 years now, there have been some studies where they restricted intake to around 1% of body weight in dry matter. Yes, that achieved significant weight loss, and researchers reported no adverse effects on the welfare of the horse. But in that study, the criteria they actually used to measure welfare related to sort of behaviour and the time that ponies spent in 3 major behavioural categories, so things like eating, resting and play. They didn't necessarily look for things like gastric ulcers. And the study lasted 12 weeks. And interestingly, also in human and pet nutrition, a 12-week time frame is basically short term. Okay, that's what we're looking at. A short-term effect or implication of a dietary change is around 12 weeks or 3 months. And since then, obviously, as the awareness of ulcers and other issues has probably increased, further studies have been done, and more recently you can see the sort of level of or the minimum requirement of forage has basically increased. So Dave Rendell and colleagues, which was the European sort of a consensus statement on sort of trying to find the right level to feed to good doers for the sort of long-term management of these horses, would go to 1.5% dry matter basis. And I think that's probably the level most nutritionists would work to. And as I say, it's the long-term management of good doers and overweight animals that we're talking about. Now, in an acute scenario, an animal that's got maybe laminitis, or they've plateaued in sort of an obese state, you can't shift the weight off, or they're not responding to any medication you might be giving, then we may need to go lower than this, potentially for the short term ideally, and under veterinary supervision you might want to go for longer than that if you're still struggling with issues like laminitis. But the aim would always be to try and return to 1.5% if possible. And I guess the take-home message really from this is to try and use less calorie dense forages so you can actually feed more. And I think it's a couple of years ago now, we did ask customers and people on our sort of database about what some of the challenges are when we have these overweight horses, and what their biggest concerns were in relation to trying to keep horses at a healthy weight. And it was quite striking that, and I think this reflects the increase in diagnosis of things like ulcers and awareness of them as a problem. We're all conditioned, rightly so, to feeding plenty of forage and not dropping too low so that we don't increase the risk of problems, but actually that can result in weight gain. And we know that we have a lot of overweight horses and ponies in the UK, so trying to find that balance is obviously key to getting it right. And it did, all of this sort of feedback really did contribute to the development of one of the products we've launched recently, which is also light. So where does fibre come from that we use in horse feeds? Well, we have the sort of byproducts, and really I should update that slide to actually say co-products, because these days any element of food that's produced is valuable, and from a sustainability perspective we should treat them as valuable resources. So they're not really sort of byproducts or waste products, which can potentially have negative connotations. They're co-products that can be put to good use either as energy or feed. One of those would include straw, so tends to be the least digestible, but we have other things like oat feed or wheat feed which come from around the grain itself. As they're milled and separated, they tend to take a little bit of starch with them from the grain, so that's why if they are used in feeds they have a higher starch value than some of the other ingredients available to us. We also have legumes, which would include things like alfalfa and clover. So obviously you do tend to find those fresh in places around the world, and they can be sun-dried or they can be high temperature dried as well, so or artificially dried using hot air. We have grass, which we're most familiar with, fresh in the paddock or in a conserved form. And we have things like sugar beet as well, which is effectively a root crop, so it grows underground. The sugar is then actually removed for use in the human food industry, and that leaves us with a really highly digestible fibre. And if it hasn't had molasses added back in, the sugar level in sugar beet is actually below 5%. So because we abbreviate it to sugar beet rather than calling it sugar beet pulp, it tends to suggest that it's higher in sugar. It's sort of implicit in the name, but actually because it's the pulp and not the sugar, it's a really useful, highly digestible fibre source. And just looking at I suppose the element of it that we're most familiar with, and the contribution from pasture, I sort of add this slide in, and again that's probably going to need updating because as our climate is changing, we've sort of suspect, I guess, that the energy supplied by grass is going to exceed what most leisure horses need for most of the year. So across the graph in the green line and then the sort of dark bluey black line, you can see the energy that's required for a 500 kilo horse. And then the yellow line is actually showing you what the energy contribution of pasture is, assuming the horse is out sort of 24/7. And it's really only in the depths of winter that even the sort of maintenance requirement just dips below, or the energy supplied, sorry, dips below the energy requirement for maintenance. Now the gap is obviously bigger if you're starting to do a bit more work, so light work through the winter months. It's a great time to try and get some weight off a horse because the grass is contributing less. But as our climate changes, that graph probably is going to need to be updated, because certainly down here today in Essex, it's been around 11-12 degrees, grass will still be growing. And yet in the summer, there was very little grass at all because of the hot, dry spells. So we're probably going to have this slide turned on its head very shortly. Actually now we can have more grass in winter than potentially in summer. But the principle is that in many cases, pasture can make a really significant contribution to the energy required by a lot of the sort of light work, leisure type horses. And in that context, we then need to sort of balance the ration and think about what else we need to put into the diet of the different types of horses. Now, there are times when we're going to need to restrict access to pasture, and that may be for weight management reasons. So native ponies, those sorts of breeds are going to do very well on relatively little, so we might have to restrict their access. But it may also be for practical reasons. These sports and performance horses don't tend to get turned out quite so much or for as long a period of time. So that's when forage or conserved forages come in, and we use them as an alternative. And it really comes down to trying to choose the right one for our particular animal. The energy value of these forages and these options available to us really are determined by the digestibility. So at one end, or the lowest end of the spectrum, we have straw, so it would be around 4 to 5 megajoules per kilo of digestible energy. And the other end of the spectrum would be things like alfalfa and sugar beets, which have much more digestible fibre and therefore contributing in the region of 10 to 11 megajoules per kilo of digestible energy. So the digestibility really means how much the horse can extract, or the microbes can extract from these forages in the time available, in the time it's spending in the digestive system. And yes, we can use fibres to effectively make up mixes and cubes, and they are providing fibre, but they're not necessarily giving you the same level of chew time. So they may well be described as high fibre feeds and very accurate in that description, which is obviously better than having a low fibre, high starch mix or cube, but they don't give you the same level of chew time that some of your short chop fibres would. So even if you're using a high fibre cube, adding that extra chop to increase the chew time and increase the time it takes for the horse to consume it is advantageous. The top sort of factors really affecting forage quality, obviously the type of plant we've got in there. So we've talked about grass, cereal straw, etc. When it comes to grass, we're looking at different species, so things like timothy or ryegrass. And we do tend to make generalizations, which on the whole are reasonably fair to do, i.e. timothy tends to be higher in fibre and lower in sugar, and ryegrass tends to be the opposite. So relative to other grasses, it's going to be the higher sugar one, but that doesn't always apply. And analysis is really important in that context, because to understand just what your forage is contributing is increasingly important if you have an animal that's insulin dysregulated, such as in EMS or laminitis. You want to know, regardless of what type of forage you're using, exactly what it's providing. Timing of your harvest is really important. So the maturity of the plant at the time it is cut is going to determine how digestible it is. As a plant grows taller, it needs more structure to hold it upright. That structural carbohydrate is the bit that's the least digestible. So the older it is, the least digestible, the more fibrous it tends to be. And because people do get caught out, they want late cut forages and they ask for something cut in, say, August, but just specify first cut in August, because a second cut in August will be a very different prospect to something that's a first cut. Weather conditions, again, these long, dry, hot, bright summers potentially are giving us forages with much higher levels of sugar, because the more sunshine and light you have, the more sugar is being produced. It's the end product of photosynthesis. We saw some of the highest levels we've seen back in 2018. They can be up to 35% plus water-soluble carbohydrate, which is all of the sugar in the forage. So again, watch out for that. And so timing of cutting becomes really important. The plants tend to use up sugar in the dark and make sugar in the light. So if you can cut early if possible, before it's had a whole day of photosynthesis, it makes sense to try and cut your hay first thing in the morning if you can. And obviously working with your local supplier, if you have a good farmer that will help you and trying to tailor make your hay for you, it's well worth having conversations with them. One of the things I just wanted to highlight is the differences in terms of hay versus what we call precision drying these days. So the top image actually shows one of our dryers down here in Essex. And what we're doing is effectively tumble drying the crops. So we're using hot air to take the moisture out, so we can harvest the plants when they're younger and they tend to be wetter and more lush, if you like. And it passes through the hot air, so it's not having direct contact with heat as such. It's the hot air that gently takes the moisture out. But it allows us to trap the nutritional value of these young plants. Whereas with something like hay, you let it grow to maturity, it's really tall, and it's going to have a much higher level of indigestible material in it. So that's the sort of fundamental difference between these sort of bagged forages that you would buy usually to go in your bucket versus your sun-dried forages. The drying process we use virtually destroys your mold spores, because you're taking it down to a really dry level. So it's usually around 9% dry matter, so less than 10% moisture. It helps to keep a really clean forage, so you get that consistency. With sun drying, obviously, we are very reliant on the weather. Now, quick quiz question. What am I? So this material actually contains around 750 grams of total sugar, 500 grams of which is the simple sugars, and it's going to give you about 30% of the energy required by a racehorse, along with a bit of starch, quite a lot of fibre and some protein. And it's very difficult to obviously do this, so if anyone's going to quickly pop an answer in the chat or the Q&A, you're very welcome to do so, but I'm going to reveal the answer. It's actually a 5 kilo hay net. So when you look back at the level of sugar, it often surprises people just how much you would actually get. So, 3/4 of a kilo of sugar there. And, we assume that just because something is high in fibre, it's actually low sugar. Well, that isn't always the case. And it certainly applies in the total ration as well when we compare and contrast. And this is a little exercise we do with some students and as part of training exercise, because we want to look at how much is fed as well as the percentages of these nutrients in these different ingredients that we use, because we often get told, oh, I've got to feed less than 10% protein, or I've got to feed a 10 to 12% forage, etc. And it's like, well, of what? 10 to 12% of how much? Because until you actually apply it to a physical amount of food, that percentage is a little bit meaningless. And when we look at rations, and I'm not saying for a moment that the sort of pony cube light chaff ration is the ideal, but often these sort of pony cubes would be considered to be sort of the evil element of this ration. Why are you giving it any bucket feed? And again, I repeat, I'm not saying that you should be, but when we look at it in the context of just the contribution and the amount of sugar that these ingredients are actually contributing, it is the hay that is the vast majority of where the sugar that is in that feed and in that ration. So it's important that we look at percentages, but it's also important that we look at just how much we're feeding and then consider the relative contribution of these different ingredients. Now, often, obviously, we can take the pony cubes out for this sort of pony that really doesn't need them. They're not being fed at the recommended level, so he's not really getting the benefits of the vitamins and minerals that they do contain, and would be much better to have him on a vitamin and mineral supplement and a balancer. But you can see the point in terms of trying to look at what we're feeding it, and as well as what it's got in it. And I just wanted to share some information about the different forages that are available to us in terms of the conservation techniques we can use. So Cecilia Muller is a researcher based in Scandinavia. She does a lot of work and analysis and research studies on forages, and the hay, the haylage and the silage columns are from her study. And what was really nice about this study is that she took them all from the same field or same pasture and just conserved them differently. So she was reducing the number of variables. It wasn't hay from field A and haylage from field C 5 miles down the road. It's from the same plot. So we're getting to see what impact the conservation technique we're using actually has on the nutritional profile of these different forages. So you can see the silage on the right, which we don't typically feed in the UK to horses very often. The dry matter is very, very low, so 30.9%, which is a very low dry matter. It's not that much more than grass, basically. Then we have haylage in the middle, which a true haylage we would typically consider to be somewhere in the region of 50 to 60, so it fits right in the middle of that range. And then we have hay, again, really dry, sort of 84% plus dry matter would be typical for a hay. What we're seeing and what I've added into this table is the sort of wrapped hay, which is a term that I think is gaining a bit of traction for some of these forages that are dried to the point really where they're not a haylage, but they're still wrapped in plastic. So a wrapped hay. And the reason we want to call it a wrapped hay is illustrated by the WSC, which is our water soluble carbohydrates, so our sugar levels in these forages, and also the lactic acid, which is one of the end products of fermentation, and it's a marker of how much fermentation has actually occurred in these forages. So in a true silage, where you've got a really wet forage, the fermentation has been really significant. So you can see the level of lactic acid is really high, but the level of sugar is low. It's down at 2.6 because what has happened in the fermentation process is that sugar is being converted to fatty acids. Okay, so that's properly fermented. You can see in the haylage that you've got the same sort of process going on. So the sugar level is a bit lower than the hay from the same field, and there's a bit more acidity, but not as much as in the silage. And obviously with hay, the sugar level is what it is, and there shouldn't be any fermentation going on. But with what we're seeing with wrapped hay, and obviously this is data from the analysis we do for customers, sort of added in to sort of demonstrate the point really. It's obviously not from the same field, but you can see that the WSC levels, the sugar, are comparable, and there's very little lactic acid present or end products of fermentation present in these wrapped hays. So they're too dry to ferment. Okay, so actually they're more like a hay in terms of their nutritional profile, even though they're wrapped in plastic. And the point that Cecilia Muller makes also is that once you open these wrapped hays, you do need to watch for deterioration, because they haven't been sort of pickled as the fermentation process is effectively doing with silage and haylage. So they will start to deteriorate, because the pickling process does help to stabilize those other forages once they're exposed to some air as well. And Cecilia even goes to the lengths of saying putting a thermometer in the middle of your bale if it's like this, because if you can see the heat and the temperature rising, it's an indication of you've got some microbial activity, and that forage is starting to deteriorate in quality as a result. So I think it's worth spending time on this so that we know, what we're putting into our horses' rations, and understanding what the sugar levels in particular are likely to be in different forages. And we're often asked, so what should you use, or what should I use? And it's often, what have you got? Because in the real world, we're battling against things like forage availability, and increasingly people this year have had to use forage in the summer because of the pasture drying up and not basically being non-existent. So they may well have already started to use their forage allocation for this year. So we're going to be pushed into using some things that may be less than ideal in the thick of winter. So what we tend to find as a general rule in the real world, wrapped forages tend to be harvested earlier than hay. So the plants are younger, they're more digestible, and therefore the horse extracts more from them. But it's likely that hay is actually going to be higher in sugar than haylage. So we really are starting to consider, is the sugar content the more important issue, or how fattening is that forage likely to be? They're not always the same thing, but the default recommendation tends to be to go to hay, because it's usually higher in fibre and therefore less digestible and less likely to promote weight gain. And by doing that, if we can then try and reduce the sugar content, that's the preferable strategy for a lot of these good doers. Is soaking the answer? Again, there's a lot of debate about this. Researchers have suggested or made recommendations for trying to use 10 parts water to 1 part hay, which in a lab study, you do your work in a study in much smaller scale, that's potentially feasible and achievable. When we scale that up to hay nets, I'm not sure how practical that would actually be for the vast majority of people. And in also temperature, warmer water tends to result in more sugar being lost. And the researchers, this was actually someone presenting at Beaver, I think last year, those factors, if we can use a much bigger amount of water and warm water, then you can actually bring the time that you're soaking your hay down. And in those cases, a couple of hours is suggested to be sufficient. If you are going to soak for longer, then changing the water regularly, especially in warmer conditions, is really important. The longer you soak it, the more other nutrients you will lose, as well as the sugar, and you're losing the sort of dry matter itself. And then research suggests feeding more is actually required to ensure that you're getting your dry matter intake. So the kind of, again, the take-home message from this is really better to start with a lower sugar forage if you can in the first place, and reduce your reliance on soaking. So, it can help to reduce sugar, but it's not 100% certain that it's going to be sufficient. I'm increasingly an advocate for the use of straw. I would start the conversation by saying not for those with dental issues and history of impaction colics, as we've seen and heard. There's some really drastic things that can go wrong. So it's something to talk to your vet about if you have any concerns about your horse's ability to chew straw and digest it properly. But it can be a useful partial alternative. Anti-straw sentiment tends to come from one of the studies that was done where again, in Scandinavia, straw is used a lot, and in some cases it was the sole forage used or the predominant forage used, and in those cases it actually contributed to an increased risk of ulcers. And again, because it's low in calcium, it hasn't got many of the other nutrients that would help to buffer acidity in the digestive tract, and that was one of the reasons sort of put forward as to why it increased the risk of ulcers potentially. But the same research group have done follow-up work, and they're showing that up to 50% wheat straw to replace haylage had no ill effects. The rate of consumption of straw when it's mixed with that haylage was actually slower when fed haylage alone, so that's good. We want to occupy the horse for longer, particularly if they're a good doer. But what the impact of that was that it also seemed to result in a lower insulinemic response. In other words, we didn't get the peaks and troughs in sort of glucose and insulin that we might with using higher sugar forages. Obviously, straw tends to have a lower sugar content than grass-based forages, so we would expect that. But in the evening meal, and this is why I think it is really a potentially exciting piece of work that could really help some of these insulin dysregulated animals, the rate of intake was so slow using the combination of straw and haylage that there was basically no significant increase at all in the insulin levels. And it really does suggest that we've got to look at this from two perspectives: the level of sugar present in the forage, as well as how quickly it's being consumed. They're both important strategies in trying to manage these horses with insulin dysregulation. And again, even if horses don't consume the straw, it might seem a little bit wasteful, but if they spend their time picking it out and trying to separate it because it's not particularly palatable, well, actually that's serving a purpose too. If it's slowing down some of these greedy types, trying to make the forage last longer, I think that's actually a positive thing as well. And just to put it into context in terms of the amount of energy reduction, if we were on some basic calculations, if we're replacing about a third of average hay from the UK with straw, it would amount to about a 16% reduction in energy or calories. And obviously, if we're replacing haylage or really good quality forage with straw, and maybe even up to 50%, that reduction in intake could be as much as 25%. And that's a huge difference, particularly when you think back to how big a contribution this hay or forage is making to the horse's overall intake. In that little exercise, it's around 95% of its sugar intake. If we can reduce it that significantly, then it's going to have a big impact on their weight, their sugar intakes, and also their insulinic response. I just wanted to finish off on just a little bit of comparison between the different types of ingredients that you might find in chopped forages in bags. The three core that tend to be used are straw, which you'd find in hi-fi range. It would also be the base ingredient, things like your molasses chaffs. Grass is obviously commonly used, so in products like meadow grass, but also ready grass, those kind of things, and then alfalfa. In amongst that, you would also probably have things like samfoin, which aren't as commonly used, but they would be in the category with alfalfa as well. And if anyone has a particular ingredient they want to ask about, I can answer that at the end. But these are the three sort of core groups. And the reasons you might want to sort of choose between them are obviously laid out there for you. But they really come down to things like the level of calcium to act as a buffer. So obviously we're advocates for the use of alfalfa because of its natural high levels of calcium, which do buffer, but also the sugar content. And that's where alfalfa in particular sort of really scores highly, because you get that buffering, you get a really good level of energy, but you're not getting the levels of starch and sugar that you would in other ingredients. And just one of the, I suppose, takeaway notes or messages I'd like to sort of really share is that when companies are declaring sugar values on forage-based products, it's well worth asking them what they're testing for, because if they're testing for simple sugars, the levels will look really low. What they need to be testing for to give you as a customer a really informed piece of information that's useful is the water-soluble carbohydrate. Because when you're putting grass into these forages and these blends of different fibres, the level of water-soluble carbohydrate will have to be higher than if it's an ingredient or a product that's got alfalfa and straw in predominantly. Okay, because that's how grass stores its sugar. With alfalfa, when it makes sugar, it's a plant, it's photosynthesizing, it makes sugar, but when it stores it, it actually takes it down into its roots, so below the ground, and stores it as starch there. So yes, it's still photosynthesizing, yes, it's producing sugar, but it's putting it into the roots, and we don't feed those to horses. So the leaves and the stalks from above ground are very low in sugars and very low in starch for that reason. And similarly with straw, it puts all its energy into the cereal grains. So that's where the sugar is then stored as starch in the grains, which we typically eat for bread and flour and all those sorts of things, or obviously are used in animal feeders as well. But the grass, however well they harvest it and time their harvesting, etc., if it's not a WSC value, it's not giving you the full picture as to what your horse is consuming. So ask your supplier for that piece of information. The downside to straw is that it tends to be a little less clean, shall we say, because it's sun-dried. It's going to typically have a higher mold count. Molds are everywhere. They can't be eradicated completely, so there will be some mold present in all of these forages. The precision dried or high temperature dry gets them very clean. They're not sterile, so there's still going to be a little bit in there, but the sun-dried forages tend to typically be much higher. So that's why we tend to say they're better suited to leisure horses, where respiratory health is obviously still important, but not as essential to performing at elite levels. So the performance horse end is where you'd go to for the grass and alfalfa. So hopefully that just gives you a bit of an insight to the different ingredients and their pros and cons. And just to make the point that we would always advocate putting something alongside forage-based rations, usually in the form of balancers or supplements, because the majority of horses can do very well on forage-based rations. But what we're lacking in forage are these essential vitamins and minerals. So things like vitamin E, copper and selenium are typically the ones that would be very low. And that's because plants reflect the soils they're grown on. In the UK, we are deficient in copper and selenium, so they tend to be in low levels in forages that grow on them. So just popping in a balancer or a supplement will balance the ration. There are different ways you can do that. So some feeds actually have the vitamins and minerals in, and would obviously give you a little bit of extra things like glycine and essential amino acid, which is also what you tend to typically get from balancers above a supplement. But everybody's looking at probably costs of keeping horses in particular this year, so supplements can offer a very good value option over the winter months. In particular, if you're not riding as much, a good quality vitamin mineral supplement can often be sufficient. But do speak to nutritionists and feed companies. They will give you advice on how to balance the ration in a cost-effective way for your horse. So just to finish off with a few take-home messages, really, horses have obviously evolved on a highly fibrous diet. So what we're trying to do is replicate that in the domestic situation. Yes, pasture is great. If our horses can have more time out there, they're generally happier and healthier, but it's not always the most appropriate source of fibre. So if you have a good doer, a laminitic, then you've got to be looking for sort of conserved forages as an alternative. And if you're going down that route, the minimum you should be looking to feed every day for good gut health or digestive health is 1.5% of body weight on a dry matter basis for their long-term management. If you can use more of lower energy, lower sugar forages rather than reduce intake, that's always got to be the approach to take if you possibly can. And then when you are actually looking for more energy, moving towards high quality fibres and potentially using oils and things like micronized linseed are a great option to try and give you that slow release energy that again is sympathetic to the digestive system. And if you do need to then look at mixes and cubes, try to find those with the lower levels of starch if you can. And all of that is giving you slow release energy, so you're likely to have a happier, healthier and a better behaved horse as well. So any questions for Julia? I can see a couple coming up, so if I just stop sharing the screen, hopefully Julia is still there somewhere lurking, and we can have a quick look if there's any questions there. Okay, so Julia, if you're happy for me to read the question out so everyone can hear it. Okay. Have you had a chance to look at the one from about, where are we? A gassy colic. At what
So
stage?
hi, Laurel.
Yeah. At what stage is the testing for the insisted small red worm count at, please?
So the test is absolutely available. We can send it off. That's not a problem. So the test for redworm is a serology test. So what that means is it is looking for antibodies to redworm, and that includes all stages of redworm. So the infested redworm and adult redworm. So all it is telling us is exposure to redworm. So if a horse has had a high burden and then gets wormed, that test will remain high for quite a few months afterwards. So that's the first thing to just sort of bear in mind, that it's not necessarily that helpful if the horse has received a worm recently. But yeah, absolutely, we can. It's a useful thing to do with horses that are recurrently colicking. It is relatively new, so we are still working out how it kind of fits in, and how the results are reported are they give you a percentage chance of the horse having a specific amount of worms. So there's levels of 1,000, 5,000 and 10,000 total worm count. But what we don't really know is how that fits into clinical disease. So many horses will live very healthily with much higher levels than that. And when we see clinical cases of larval sarcoidosis where they've got severe diarrhea, we are often seeing cases where they've got hundreds of thousands, if not millions of worms. So whether we need to worm a horse just because it has 1,000 worms, we're not quite sure. But yeah, I think if your horse is getting repeated bouts of colic, and it might be useful to do. Especially, well, often when people say if they colic after they've received a wormer, what that sometimes suggests, and not always, but what that sometimes suggests is if that there has been a significant worm burden, and that those worms have been killed by that wormer, which has then upset everything and caused the colic. So yeah, I hope I've answered that really generally, but I know you're a client of ours, and I'm very sorry I don't know the specifics of your case, but please pick up the phone and give me a ring tomorrow and we can have a chat further.
Yeah, I think that's a great sort of general answer for that one. Thank you. And similarly, as a general sort of thing, have you had any success with particular supplements for problems like free fecal water or medications or anything along those lines? It's a really tricky one from our perspective.
It is a tricky one. I will often advise people try a pre and probiotic, but in all honesty, I'm not 100% convinced that they make that much difference for it. And I think the biggest thing is trying different forage sources. And that would be where I'd go first, really. I mean, there are lots of pre and probiotic options out there, so you can do that as well. But I think changing or experimenting with different forage sources is probably more important.
Yeah, and I think it's probably one of those, again, where we've got an umbrella term for multiple sort of potential different causes and problems that all sort of potentially result in the same sort of symptoms. I'm still the kind of forage side of things that we're still trying to figure out what it is in a particular forage that might be triggering it, and we've looked at things like silica levels and all that kind of stuff, but again, doesn't seem to be any correlation that we can see in forage analysis and things. But yeah, digestive aids are worth a try, I guess. Have you had any experience of, or do you have any views on sort of fecal transfer in horses? I know the webinar I was listening to this afternoon, there were some important points raised in terms of actually inadvertently transplanting resistance to antibiotics and all sorts of other things as well in other species. But do you have any thoughts or feelings on that?
Yeah, so I've not actually done it personally. It's something that gets talked about as an option quite a bit, and has been talked about for quite a few years now. I think it's quite Heath Robinson, when people are doing it in horses, they are just taking a sample from a healthy field mate and giving some drugs to reduce the acid, so that you're trying to get it down to where it's needed. And yeah, I think I have no personal experience, and in theory, yes, it's a good thing to do, but I think we're a bit of a way off from doing it regularly in horses.
Yeah, I think, as you say, they're having a protocol to follow, and they seem to be trying to standardize it in things like in species like dogs and cats, but trying to find, and it all comes back to what is healthy, doesn't it, in terms of a healthy donor. The microbial population that is normal for one animal is very different to another, so not always going to work giving the one that outwardly looks healthy to something that's got a problem. It doesn't mean to say it's going to work, but let's have a little look further down if we've got some other ones. Is there a reason that it was one of the questions that came to mind during your presentation to me, that the development of new wormers isn't happening? Is it just finances and demand, or are there just not drugs out there, or just not proving successful?
I think finances does come into it, but as it's not an area of my expertise as the sort of pharmaceutical industry, but yeah, I just think that there isn't any promising drugs available. And then, believe it or not, the horse market is a very small market, so it financially does cost a lot. But I think this is going to be a critical, I think we will get to a really critical time point, and I think I think finances, we will have to find some more drugs, but there is nothing new at all coming up. So even our moxidectin and things like that, that's actually been around for a couple of decades now.
Yeah, I mean, yeah, I'm sort of the panacea side of things. It's quite scary that that's still the only option for some worms, which is, yeah, very thought-provoking. Tracy behind the scenes has been very kindly answering the nutritional questions, so I think that's all the questions that have come in, unless anyone, I am conscious of time.
There's a lot on ulcers that I can see.
Oh, is that? Oh, gosh, why am I not seeing those? Hang on. Oh, open. That would help.
So there's a couple of questions about ulcer grade, aren't there?
Well spotted. So yes.
So are there any ulcers irreversible when they get to a certain grade? No. We can nearly always get rid of all of them. There are some problematic ulcers where, whether it's a management point of view, that they just keep reoccurring. But yeah, we should be able to treat all of them. And then, what grade of ulcers, gastric ulcers, would you say is regarded as an emergency? I don't think any is a true emergency, because this tends to be more of a long-standing issue. And it's not a case of, if you treat them sooner, they go, they're less likely to recur or anything like that. So yeah, there's nothing that's an emergency, but grade 3 to 4 is almost definitely going to be causing some issues for your horse. Grade 2 possibly, grade 1 less likely. So
yes, and there's another question actually relating to colic surgery. If a horse has had surgery before, what would your response be if they needed surgery again? It's going to be a difficult one to answer, I imagine.
Yeah, that's okay. If they've had surgery in the past, not just the recent, not within the last few days or anything, if they need surgery again, absolutely go for it. There is no reason not to go for it, and the best thing to do then is to allow the surgeon to have a look and see what is going on. And we are often actually on the phone to clients in the middle of surgery and saying, look, this is what we found, the prognosis is this, do you want us to continue? It may well be related to the original surgery, or it might be something completely different, and until you have a look, you have absolutely no idea. So if your horse has had colic surgery before, there is nothing stopping you going again.
We just hope you're never faced with that situation. Does it happen commonly? Is it something you having to operate?
Not that common. What is common is to have to take a horse back to surgery within a day or so of the original surgery. So yeah.
And then actually there's one, I think Caroline's asked, hello Caroline, what are your feelings about feeding mashes containing alfalfa from a buffering point of view. So that's probably one for me. I'm not sure if Tracy's had a chance to answer that one yet. She's busy working away down the bottom on another one. So yeah, I think obviously you're not getting the sort of benefits of the chewing, because the mash is going to be a lot easier to eat and chew. But you have got that natural buffering from the calcium and potentially other components in the alfalfa. So if someone doesn't want to use a chopped alfalfa, then our recommendation is to use alfalfa pellets or an alpha beet type product soaked up into a mash. And then if you want to put chopped grass or something like that, that might be softer in it to try and slow the rate of consumption, you can take that approach. Or, you know, if the horse can't manage any chopped fibre, then certainly a mash is better than nothing at all. But yes, alfalfa has natural buffering benefits, and in fact it's very good at buffering itself. When we've tried to ferment it to make haylage, it doesn't want to ferment, so it's naturally basically going to fight you every step of the way. So yeah, it works in its own right, whether it's in a mash format. That just the fact that you've got it chopped is going to give you so much more chewing and saliva production. So yes, some is better than none. Should horses be kept off the pasture after working? Not like, in my view, if you have cooled them down and they're basically fine and back to sort of resting heart rates and all that kind of thing, there isn't any reason to keep them off pasture after working. And the fact that they can move around helps to clear the lymphatic system as well. So if you can't cool down for 20-30 minutes, which is really what you should be doing if you're working them hard, then allowing them to freely move is kind of the next best thing. But you would want to obviously make sure, you know, they're sort of back to normal before you're putting them out there. I don't know if that answers that question, but if you want to put a little bit more information into explain what your concern was particularly, I can try and answer that. I think that's probably covering off everything there. Thank you, Tracy, behind the scenes, for doing all the questions as well, and a huge thank you, Julia, for giving up your evening. Really appreciate that. It was fascinating talk, some brilliant images and video, which just brings everything to life. And I'm sure everyone, if they want to get your email address, they can contact us and we can pass it on if anyone has further queries. But thank you everyone for attending as well. Many of you have stuck with us all the way through, so thank you for that. But I'll bring the webinar to an end. As I say, it'll be on YouTube in the coming days, so if you would like to watch it again, please feel free to access it there. But I'll say bye-bye and thank you very much and take care. Thank you everyone.
Thank you.